All right, welcome to the hand and the wrist. Okay, the hand and the wrist are pretty interesting. They're marvels of our biomechanical engineering here. And what I like about them a lot is I had a professor my first semester when I took anatomy and physiology that says almost every system in the body exists so that you can get your grubby little mitts on anything. And it's a very complicated structure. It has a lot of power in it, when you think about our grip, but also delicate finesse. A concept that you may have discussed in this class or another is innervation ratios. And when we look at the muscles of the hand and wrist, it's very highly innervated. So we have muscle motor units. We have motor units that are controlled. Oh my gosh. The innervation ratio is higher here, so we have many, many more smaller motor units for fine control. Today, we're going to unpack the muscular, bony, and ligamentous anatomy of the hand and wrist with a focus on their function and how they integrate together. Let's start with the bones. It's not really shown very well on these diagrams here, but the wrist, we have scaphoid lunate, triquetrum, and the pisiform. And then the distal row lateral to medial is the trapezium, trapezoid capitatum, hamate. Hamate, yeah, has the hook, it's very easy to identify. These carpals are going to articulate with the five metacarpals. So that's going to be right here, this sort of part of the hand. This is the back of my hand. The five metacarpals, which are the bones of the palm, and the phalanges, the 14 bones across the fingers and the thumb. Wrist joint, it includes the radiocarpal joint. That's going to be the radius articulated with the scaphoid and the lunate. Has the midcarpal joint, which is the joint between the carpal rows, and the distal radio-ulnar joint, which is going to rotate. These bones are going to form the scaffold for our wrist motion and our hand dexterity. Some ligamentous structures to note are the palmar radiocarpal ligament. It's going to connect the radius to the carpals, and it's going to limit our ability to extend. We have the dorsal radiocarpal ligament, which is going to stabilize the wrist when we flex like this, right? And we mentioned the ulnar collateral ligament, UCL, ulnar styloid to the triquetrum and pisiform. So this is not the same as the UCL of the elbow. This is going to be stabilizing the styloid to the triquetrum right here. And we have the radial collateral ligament, the RCL, which is radial styloid to the scaphoid and trapezium. We also have some intrinsic ligaments that bind the carpal bones together. A good example of this is the scapholunate ligament, which is critical for coordinated carpal movement. In the hand, we have volar plates that reinforce the metacarpal phalangeal and interphalangeal joints, which resist hyperextension of the finger. We have collateral ligaments that stabilize each finger joint medially and laterally so it doesn't get bent out of place. We have the flexor retinaculum, the transverse carpal ligament that forms the roof of the carpal tunnel, which secures flexor tendons and the median nerve. So let's talk about some muscular anatomy here. Our wrist flexors in the anterior compartment. So you can see our flexor carpi radialis right there, right on the medial side, but it's more towards the center of the arm. It's gonna insert onto the base of the second and third metacarpals, and it's gonna do wrist flexion and radial deviation. You can see based off of how it's angled, since it crosses the midpoint right there, if it shortens that way, it's gonna deviate towards the radius, right? Then we have our flexor carpi ulnaris. It's going to insert into the pisiform and the hook of the hamate and the fifth metacarpal. And it's going to do wrist flexion and ulnar deviation, right? So flexor carpi ulnaris, which is really medial right there. You see if that flexes, it's of course going to deviate towards the ulna. We have our palmaris longus. It's going to insert into the palmar aponeurosis and is a weak flexor, but it is what we associate with our grip. It's going to assist with our grip. We have our flexor digitorum superficialis. It's going to insert onto the middle phalanges 2 through 5, and it's going to flex the PIP joints. And it assists in metacarpal, phalangeal, and wrist flexion. We have our flexor digitorum profundus, FDP. It's going to be on inserting into the distal phalanges 2 through 5, and it's going to flex our DIP joints, and it's also going to flex the wrist. We have our flexor pollicis longus. Anytime we see pollicis, that means thumb. It's going to insert onto the distal phalanx of the thumb, and it's going to have thumb flexion at the IP joint. We have our wrist extensors in our posterior compartment, which is on the right of this image that we've been looking at. We have our extensor carpi radialis longus, ECRL for short, inserts onto the base of the second metacarpal, and it's going to extend the wrist and radially deviate, right? Then we have the extensor carpi radialis brevis, inserts into the base of the third metacarpal. It's going to do wrist extension. Extensor carpi ulnaris, ECU. It inserts onto the base of the fifth metacarpal, and it's going to extend, but where's it going to deviate? Towards the ulna, right? Because it's ulnaris. Then we have the extensor digitorum, extensor expansions. It's going to insert into the extensor expansions of digits 2 through 5, and it's going to extend the MCP, PIP, and DIP joints. Extensor digiti minimi, as it's going to assist in extension of the fifth digit, so our pinky. Anytime we see minimi, that's going to be our pinky. Then we have our extensor indicis, right? Your index finger, your indicis, independent extension of the second digit. We have the extensor pollicis longus and brevis and abductor pollicis longus, which we can see on this right diagram pretty well. It's going to control thumb extension and abduction. Then we can talk about some of the intrinsic hand muscles right here. So we have the thenar eminence on the thumb. That's where we're going to have our abductor pollicis brevis, flexor of the pollicis brevis, and opponens pollicis right there. What we call opposable thumbs, right? That's kind of where that's happening right there. We have our hypothenar eminence, which is our pinky. We have the abductor digiti minimi, the flexor digiti minimi brevis, and the opponens digiti minimi. So it's opposition. Then we have our mid-palm muscles, lumbricals 1 through 4. They're going to flex the MCP and extend the PIP and DIP joints. We have our dorsal interossei 1 through 4, palmar interossei. These muscles function very similarly to the interossei and lumbricals of the foot. So if you understand those really well, this will make a lot of sense. Some wrist movements and biomechanics. So when we think about flexion, right? Flexion of the wrist, that is going to be our flexor carpi radialis. I'm going to use abbreviations here. Go back. You can figure them out. FCR, FCU, PL, FDS, and FDP, right? Extension is going to be ECRL, ECRB, and ECU. Radial deviation. So radial is this way with your thumb. We have our FCR and ECRL or ECRB. And then ulnar deviation, which is this way, right? We have our FCU and ECU. Grip mechanics. Power grip is going to be our FDP, FDS, and thenar muscles, and our wrist extensors will stabilize. Precision grip is where our intrinsics are going to dominate, and it's going to be the coordination of our lumbricals and interossei. So think riding versus grip activities like arm wrestling or deadlifting without straps, such as in a powerlifting competition. Looking at the kinetic chain here, the wrist must stabilize dynamically to allow for fine motor control in the fingers. That's where we were talking about the innervation ratio. A lot of nerves go into the hands to control relatively small motor units for precision. When we talk about being right-handed versus left-handed, a lot of times that precision we're able to achieve with our right hand, if we're right-handed, is due to the innervation ratio in some respects. Closed chain activities like push-ups demand isometric contraction across all compartments of the wrist and hand. Common conditions to consider with the wrist and hand, of course, we know carpal tunnel syndrome. That's our median nerve compression under the flexor retinaculum. Lateral epicondylitis is going to sometimes occur because of overuse of the ECRB. And de Quervain's tenosynovitis is the inflammation of the APL and EPB. So just some closing thoughts here, from any sort of powerful lift like a deadlift to threading a needle. Hand and wrist are going to assist in our ability to get our grubby mitts on whatever we need to. Their anatomy reflects a fusion of strength and precision. It's a very complex structure architecturally, and understanding this isn't just for a clinician. If you're dealing with climbing athletes, throwing athletes, or even Olympic athletes, it's going to be our gateway to better control, better health, and better performance. If you can't grab something, you're going to be severely limited in what you're able to do from a sport perspective. Thank you guys for watching. I hope that cleared up a little bit about the wrist and hand. Mostly just kind of an overview of the anatomy because the structures themselves are super duper complex and hard to understand a lot of the times. There's a lot of long names and everything kind of overlaps in a weird way. One thing that we want to make sure we understand is how the sort of pulley mechanisms of the hands work. So, but not to leave you high and dry on that, I'm just going to draw a little picture because it'll help things make more sense. So this is, we have our finger bones right here, our phalanges. Our superficialis, which is the superficial muscle, actually comes and it splits off right here, kind of like that. And then the profundus tendon comes underneath it, right? And attaches right here so that when you flex your hand, you're able to get a more smooth movement. And the reason it has to be that way is because if this was over top, you would have like a really thick sort of hand. Your finger would have to kind of be shaped like that, if it was bent. So if your finger bones were like that, your skin would be where that bottom red line is right there if this mechanism did not exist, right? So that's something to consider. That was on my test when I took it. So make sure you kind of understand how that works. But we're going to go into just a little bit of ultrasound here. It's kind of difficult to, ultrasound the hand muscles, but you might get to see a few interesting things and just get a new perspective on the hand. Looking at it cross-sectionally might help you understand where some structures lie and just how they look. All right, now we're going to get into some of the muscles of the forearm and the wrist and the hand. So the first thing we're going to take a look at right here, we mentioned brachioradialis before. That's going to be the biggest muscle of your forearm that serves in elbow flexion and also radial deviation. So going right here, we have probably my favorite muscle of the forearm, the pronator teres. So what I want Tristan to do, yep, he's doing it pronate. You can see it flex right there. It is that structure off to the left. Yep, that's kind of looks like it's moving into the center of the screen. That's your pronator teres. It is right here on your arm. You'll notice arm wrestlers typically have a pretty developed one, right? Not me though, because I'm not an arm wrestler. And scanning along right here, we are doing a cross section of the forearm. Let's see if I can find what I'm looking for. What I want you to do is close your hand, Tristan. Now open your hand. Close it. Open it. That is going to be our palmaris longus right there, I believe. Or is it flexor digitorum longus? Let me double check that. So what is it? Tristan's doing like that right now just to show you his palmaris longus tendon, right there. And then right here it presents a little bit differently. So So now we're going to look at some of the extensors on Tristan's hand. So if you could flip your hand over, please. Good. So I want you to close and make a fist. And now I want you to open. Open up wide. Yep. All right, and let's look at that one more time. Close, open up wide. You can see the extensor muscles contract. Those two bright structures right there are the radius and ulna. They're going to be crossed right now because his hand is in a pronated position. Close your hand, open it back up. So as we move up right here, closer to the wrist, what we're going to, let's see if I can find it. You can see a tendinous structure. It's going to be our carpal tunnel, that bright, well, it's like not super duper bright, but it's up top. That's covering all those skinny little tendons in there. Let's go back to the extensors. Just more about that. So here's another part of the extensors right there. So extend, yeah, there you go. Extend. There you go. Good. Okay, now we're going to look at the scaphoid and lunate as they move through radial and ulnar deviation the best we can anyways. So if we come right here, yep. Can we see the scaphoid? Need to adjust properly. It's my, transition. So our scaphoid is that first bump going from the right, and our lunate is on the left side. So now, Tristan, I want you to move, I want you to, deviate to one side. I can't really see nothing. Let me go longitudinally, if I can. We might be able to see a little bit more there. Okay. Here we go. So this would be our radius. That bump right there is our radius. How am I oriented? Okay. There we go. All right. And then that bump on the right side is our scaphoid. Now deviate this way. Boop. You see that? Closing the gap. That tiny little bump right there. That really white little dot. It's our scaphoid. Bam. There we go. And that's what deviation looks like on that side. Now let's look at the ulnar side. This is a pronated hand, so Tristan's palm is facing the ground. So now looking at this side, let me get back on here. Hold up, let me get the clear image. Yeah, so that is our lunate on the right side, and then our ulna is on the left. So there's the little lunate, moves down, now it's out of view, and back up. And there you go. That's what deviation looks like. And then you could, of course, see some cross sections of the metacarpals, which is pretty interesting. If Tristan closes and opens his hand, back up, you can see the muscles in between as he closes his hand. Yep, actually moves the metacarpals a little closer together. Yep. And then extend your fingers. Yep, and you can see those tendinous structures on top of the metacarpals. Extend your extensor tendons. Okay.